Welcome to the Personal Care Activity Log training for personal care aides, paraprofessionals, independent paraprofessionals, and all aides assigned to work directly with students who also bill Medicaid. Due to updates made to the state Medicaid Policy Manual, we had to update the Personal Care Activity Log. This training will provide the details of what has changed and why. Medicaid has new policy that specifically states that personal care aid / paraprofessional activity logs cannot have blank spaces for any school day. To help meet this policy requirement, Wayne Risa has created and rolled out the PCA log pictured on this slide. Let's take a closer look at the updates, starting with the billable / non-billable key codes. Here's what you need to know about the billable and non-billable key codes. For ease of tracking, the billable and non-billable codes and descriptions are listed separately. You can see non-billable there is in the peach colored section. The billable and non-billable codes are listed in numeric and alphabetical order, hopefully making it easier to locate your service codes. For those of you who have been billing Medicaid for a while, please note that since the list of billable services is now alphabetized, it has changed the numbers associated with the services. An example is redirection and intervention for behavior changed to code number 12. Please refer to the updated code numbers when logging your activities. Also, remember the codes you will bill under must match what the IEPT / IFSP or Caring for Students teams have listed as a personal care or paraprofessional activity. Now let's look at the non-billable section. Code 17, paraprofessional absent. Code 18, school closure. Use this anytime school is closed for a holiday, a snow day, a building problem, etc. Code 19 is when the student is absent. Code 20, student present, assisted by an unqualified staff. What does unqualified mean? This would be another aide or para who does not bill Medicaid. Aides who do not bill Medicaid are likely paid by federal funds and cannot bill. Or perhaps service was provided by another staff member in your building that can't bill under the personal care code, such as maybe the building secretary, principal, vice principal, counselor, the teacher, maybe the school nurse, social worker, speech path, etc. And code 21, student present but did not require assistance. Use this code when the student is able to perform a care service for themselves. Maybe your student was having a really good day and was able to stay focused and did not require redirection or intervention for behavior. Maybe they were able to get themselves to the bathroom or take care of their hygiene by properly washing their hands without being prompted. Now let's go back to a day when you are absent. How do provided services get documented? If another parapro who also bills Medicaid is subbing for you, your sub will temporarily add your students to their activity log. Your sub will put a T by the student's name, identifying them as temporarily on the sub's caseload. Your sub will also bill for them in Service Tracker for the days they covered for you. This is important because when service is provided and the student is identified as temporarily on a caseload, a review of both logs will be requested by an auditor. The auditor will compare both logs to the student attendance and the service dates billed in Service Tracker. Here is a list of the Medicaid billable services and a description of what each of them entail. As you can see, there are several items in red. The reason for this is to distinguish what is considered a nursing service as opposed to a personal care service. These items, such as feeding, tube care, tracheostomy care, administering medication, and any other procedure that needs sterilization, is by Medicaid definition a nursing service and is not billable for paraprofessionals. This doesn't mean that you can't perform these services for your student. It just means that you can't bill for them. Then you see the definitions of the non-billable codes, which we just reviewed in the previous slide. Personal care activity log also includes guidelines for accurately documenting your personal care activities. Use the information here to help with completing your personal care activity log. For convenience and consistency, the log will come pre-filled with the month and the year, and the holidays listed. As you can see for September's example, we already have Labor Day coded using the non-billable code 18. We've also included blocked out dates at the end of September 2024 to indicate the dates of the month for October. The pre-coded common calendar holiday dates and the blocked out dates for the upcoming months are complete as reported, so please leave them as they are on your sheets. Now that we have reviewed the information that the Medicaid department included, we'll review the information that you will complete on your activity log. For convenience, you can list your classroom teacher's name at the top of the log. Log detail, please include all of your students' names here that you are providing services for, not just your Medicaid eligible students. We ask that you do this because of privacy and HIPAA laws, and Medicaid eligible students aren't being singled out. Then, as you go through the month, you will document a code associated with the service you provided for the student for each day of the month. If you are providing more than one service, pick one from the IEPT/IFSP or Caring for Students documentation that identifies a personal care or paraprofessional activity and stick with that code for the month. If you have a situation that falls under one of the non-billable codes, you will use that code. At the end of the month, make sure that you sign and date your log and have the designated person, such as the classroom teacher, social worker, a licensed practitioner, sign and date the log as well. After transposing your log into Service Tracker, make sure to send them to your special education office for safekeeping. Please remember, your logs are not valid or Medicaid compliant without the signatures at the bottom. Now, here are some frequently asked questions asked by personal care aides and parapros. Can aides and paras share their logs? No. Each aide or para has their own monthly log because the service log is the official record of the services provided by that staff member, and the form must be kept on file for 7 years in case of an audit. Can I bill for another aide's student if the aide is absent? Yes. If you are taking care of another aide's students, you would put those students on your log and record the services you provided as the sub. You would also bill in Service Tracker for the dates that you provided service. And remember that you're going to please include a T by the students you've temporarily added to your caseload. Long-term subs can also bill, but they would have their own login and also keep their own log at that point. Can 2 or more staff have the same students on their activity logs? Yes. If there is more than one aide in a classroom, or if you are subbing for another aide, as we just reviewed. In closing, please do not hesitate to contact a member of the Medicaid department with any questions or concerns. Thank you.